Okay, and with that, we are live. Welcome, everyone. Good afternoon. Thank you for joining us for our May general meeting of the CSRA Parkinson Support Group. I wanted to take a moment first before I introduce our speaker to introduce myself. My name is Logan Banks, and I am the president of the board for the support group. My contact information is listed on the back page of your monthly newsletter. Please feel free to reach out to me with any questions or concerns. Our speaker today is Dr. Julie Curick, neurologist and movement disorders specialist at Augusta University. Dr. Curick completed her undergraduate studies at Brown University and attended New York Medical College. She completed a fellowship in movement disorders at the Cushing, I hope I said that right, I think so, Neuroscience Institute at Northwell Health in New York. She seeks to optimize the quality of life for those living with movement disorder by using a holistic approach and addressing not only motor, but also non-motor symptoms these individuals face. Today, she will be discussing fatigue in Parkinson's disease. At the end, we will have time for questions. If you are joining us on Zoom, please feel free to submit your questions via chat directly to me or ask them at the end when we open the floor to questions. Please know submitted chat questions are anonymous. For those of you joining from Facebook, welcome. We would love to answer your questions as well. You can submit your questions in the comments section on this video, directly message us through Messenger, or email us at info@parkinsoncsra.org. Again, that's info@parkinsoncsra.org. Now, I also wanted to, before we move on, to let you know that Martha Ann will be doing an update at the end of this presentation as well before questions. So now it is my pleasure to introduce Dr. Julie Curick. Thank you for joining us, Dr. Curick.
All right, thank you.
There she is.
Thank you for having me. And it's nice to see some familiar faces and names here. I picked this topic. I know there was some interest in ultrasound for the treatment of tremor, and that's something we can talk about perhaps another time. But I really wanted to talk about fatigue because this is something that comes up frequently at visits, and it's something that's not really addressed commonly. So if you were all on mute, I would ask you as an audience, what do you mean when you say I'm tired? And I'm sure all of you would have a different answer. Before I go on, can everyone hear me okay? No. Yes, yes, okay, thumbs up. Okay, great. So when you ask people, when they say they're tired, what does that mean? Sometimes they'll say, I feel weak, I can't move, I'm sleepy, I just don't have it in me. And the way I kind of like to think of tired is to approach it and break it down into three basic things. And once we kind of know what we're dealing with, it's a little bit easier to address. So one, there's physical fatigue. Two, there's a cognitive fatigue. So thinking about when you have to do your taxes or something that takes a lot of thinking and math, or even just a cognitive fatigue where you just could be really bored. And you can imagine like a security guard staring at a screen as part of his job where there isn't a lot of activity. And you can imagine looking at something like that hours on end could give you cognitive fatigue. And that's different from the physical fatigue where it's very in your muscles, as if you just ran a marathon, as if you were moving houses and had to move a lot of boxes, just that bone kind of tired, but you don't necessarily feel sleepy. And then there's sleepiness, which is a whole different kind of ball of wax in a third category. And one of the reasons I wanted to talk to you about this is whenever you go to a doctor, you want to feel heard. You want to have as a discussion as you can. So I think thinking about this issue and where you fall into one of those three categories, if you can think about that, you'll have a more fruitful discussion with your doctor and hopefully get more out of it. So I'm going to go ahead and start sharing my screen here. Let's see. right, can you all see my screen? Thumbs up? Yep.
Yes, we can.
Okay, good. All right. So as I mentioned, many definitions, everyone means something really quite different when they say that. So it's something we have to kind of really dig into. So, you know, all of us are tired, right? I get tired at the end of the day. That's a normal thing. And when does it become pathological? So a lot of people with Parkinson's will describe it when it becomes really kind of disabling. So fatigue can be caused by a lot of things if you just exert yourself too much, if you're not getting enough sleep, if you've worked out too much, if you had a lot of stress can make you tired, if you drink too much alcohol, or if you're just simply bored. It's very common. It's one of the most common non-motor symptoms reported by about up to 60% of patients, but looking at some of the literature, at least 40% of patients at all times report it. You know, it affects a wide range of everyday activities, and it really does. One of the things I find that really reduces quality of life when you're kind of tired, you don't really feel like you have the energy to do much. So you can imagine that's not a lot of fun. What's interesting is that it occurs at every stage of Parkinson's. It's not necessarily like some symptoms where the further you are along, the more likely you are to have it. Some people have it early on, and it doesn't necessarily correlate with the motor symptoms. One of the unfortunate things is if you do have pretty significant fatigue early on, it does tend to continue and not get much better. And it's present from the onset in at least a third of people, and sometimes it can be present before some people are even diagnosed. Some people, when they come, they'll describe themselves as feeling very tired and weak, and that's a little bit of an interpretation. So if you have bradykinesia and you can't move your arm as fluidly, some people describe themselves as being weak when it's really rigidity and bradykinesia, because when you test on strength testing, they're very strong, you're very strong. But your brain interprets that when you can't move it quite as fast, your brain kind of interprets that as being weak. So some people will feel tired, and once they start medicine, they'll perk up, but that's not always the case. So in looking at Parkinson's, kind of the easiest way I approach it, or the most common way, is to think about what non-Parkinson's causes can be causing it and to treat those. And I'll get into what those can be. It could be difficulties with sleep, it could be endocrine problems, and so on. We do know that outside of the motor symptoms, and outside of dealing with the diagnosis, and outside of other things such as sleep and maybe emotions, depression, fatigue, there is an actual what we call central fatigue in Parkinson's that's increasingly recognized. And it's thought to be related to abnormality in these similar pathways that are affected in Parkinson's. There's abnormalities in the basal ganglia. We know that dopamine is dysregulated, as is serotonin, and also norepinephrine, right? Norepinephrine is an important hormone. That's when you kind of think of as your flight and fight kind of hormone. When you're upset, adrenaline kicks in, and when you have that, you know, you feel very sort of energized, and that's missing too. So it's not just dopamine, but there's something different that's going on. It's thought to maybe be due to decreased perfusion in the front parts of the brain, but there's multiple reasons for fatigue, and one of them is the Parkinson's itself. But as with everything, we can't blame everything on the Parkinson's. There's a lot of many other reasons, and those are a lot more treatable. So that's what I'm going to focus on in this discussion, and what I would recommend discussing in your patient visits. So one of the causes of fatigue can be medication side effects. So this can be a side effect of something you're taking for a condition other than your Parkinson's. There's lots of medicines that can cause fatigue. One medication that a lot of Parkinson's patients may be on is propranolol. It's used to help treat tremor. And one of the known side effects is fatigue, exercise intolerance. Sometimes if you're just on a blood pressure medication, that can make you feel tired because, as you see, the next point is orthostatic hypotension. With Parkinson's, we know that the nervous system is affected, our blood pressure is not regulated as well as it normally is, and there are drops in blood pressure, and that can be sometimes felt as fatigue. You don't necessarily faint or fall, but just feel just kind of tired. So that's one reason. So other medications, it's kind of, you can see how treating this in Parkinson's is very complicated and very individual. What one person describes is going to be very different from another's, and so the treatment's going to be different. So in terms of medication-related effects, as I mentioned, some people, when they get diagnosed, they're tired, we start them on levodopa, and they feel better. They feel more energized. By that same token, I have patients who get sleepy from their Sinemet. And you know, it's also dose related. As we go up, it gets worse. And there are certain Parkinson's medications, for example, the dopamine agonists, you might know them as Mirapex or Requip. Those actually have a black box warning that they can actually have sleep attacks. So it can be something very similar to a narcoleptic kind of sudden attack of sleep. And sometimes it's not that dramatic, and patients on this will have excessive daytime sleepiness. So sometimes we'll have to remove those drugs. So you can see it's tricky. Sometimes the Parkinson's medicines help with the fatigue, and sometimes they make it worse. So each case needs to be looked at individually. Sleep disorders. There's, as you know, multiple sleep disorders associated with Parkinson's and also not with Parkinson's. So you have PD, you can still have other more typical issues, such as, for example, sleep apnea. If the spouse says, you know, he or she is snoring at night, one thing you want to think about is their obstructive sleep apnea. And that's associated with non-restorative sleep. So someone may get enough hours, but if they have sleep apnea, they're not getting enough oxygen and perfusion and not feeling rested, even though they've slept. And that's good to identify because that can be treated with a CPAP, okay, a machine to help you deliver oxygen and help you breathe at night. But then in Parkinson's, you have other issues such as restless legs. Sometimes you have difficulty just getting comfortable. There's that creepy crawling feeling. So you feel kind of the urge to move. Very common in Parkinson's is middle insomnia. So no trouble falling asleep, but staying asleep is an issue, especially if you have to get up multiple times to use the restroom. So you have the nocturia, you go back to bed and you have difficulty falling asleep. And if that happens multiple times per night, you can imagine you'd be really sleepy the next day. Anybody would. Then there's depression. And depression, we know, is a common part of Parkinson's. Most people have some degree of depression simply because the neurotransmitters, the chemicals are unbalanced. So one of the criteria for actually diagnosis of depression is fatigue in all the scales, basically. So depression can appear as lack of energy. It can appear like a dementia. We sometimes call depression kind of a pseudo dementia. So it's important to identify if depression is the cause here of tiredness, because that is also treatable. We can use antidepressants and different types of medication. That combined with psychotherapy and talk therapy is quite effective. So we want to make sure and see, is depression at play here? Chronic pain is also a cause of fatigue. You can imagine dealing with that on an ongoing basis, and there's a lot of interconnections connections between pain and fatigue in the brain. And there's lots of other medical reasons. I know when you have Parkinson's, it can feel very central in your life, but it's important to not forget that there's lots of other causes of tiredness. So I would recommend checking with your primary care doctor and just ruling out any other treatable things. For example, anemia. If you have low blood counts, you're going to feel tired, and that can be from a chronic disease. It can be from iron deficiency, so you might want to check your iron levels. And sometimes, especially in older populations, absorption of B12 might not be so great, and that could also be contributing to low energy levels. And those are easy to check and easy to treat. If you're dealing with a thyroid issue, that's something you want to check. Is your thyroid hormones okay? Is there any, you want to think about anything rheumatologic, if you have rheumatoid arthritis, lupus, and a history of cancer. You also want to think about hormones too. There's been some studies into hormonal therapy and replacement. And anecdotally, I've had a few patients, a few men who said they were tired and were found to have low testosterone levels. And with some replacement, they actually found that they had more energy and felt better. So these are all non-PD things to think about and to rule out. I referred to some of these already, but just to go over, what are some medications you're taking that can be causing fatigue? So I mentioned those dopamine agonists already, and your carbidopa, levodopa, your blood pressure drugs. So in Augusta, the allergies are pretty bad here. In March, everything has a nice green coating. So taking allergy medications is pretty common. So keep in mind that these can make people sleepy, and sometimes this diphenhydramine, the Benadryl, is sometimes used as a sleep aid. So if you're dealing with pain, gabapentin, we don't use opioids too much, for the addictive potential and also worsening of constipation, but gabapentin is used pretty frequently. And this can be definitely a cause of fatigue. I do think it's helpful if you need to take gabapentin for pain or for some reason to take it at night. It can actually help you sleep. And if it does make you sleepy at that time, that's actually a good thing. As I mentioned, anxiety is quite common in Parkinson's. So the benzodiazepines, lorazepam, alprazolam, clonazepam, those can make you quite sleepy. I generally try to avoid dosing those during the day if possible. And we'll give them in the evening to help people sleep. It's also associated with more falls. So I would just take those sparingly. And muscle relaxants, we know dystonia as a part of Parkinson's, that kind of muscle contractions and pulling and pain. So a lot of muscle relaxants, cyclobenzaprine, you think Flexeril, Robenal, any of those things can make people quite sleepy. And then some of the mood medications, you think amitriptyline has some anticholinergic side effects, even though it can help mood, and I mentioned depression can make you tired, it can have that kind of antihistamine effect too, like the allergy meds, and make you a little bit sleepy. And this is just a preliminary list of some of the common medications. So you always just want to take, if you're feeling tired, just review with your doctor. Could any of these medications be contributing to that? And can I change it to something else or eliminate it? So what do you do if you're tired? So really important to talk to your doctor. I would say what you want to do is kind of keep a little bit of a diary and kind of take note if you're noticing any patterns. If you notice a pattern, there's something we can intervene on. So when do you feel tired? Is there a certain time of day? Does your fatigue occur or change with your Parkinson's symptoms? Do you notice you're more tired when your Parkinson's symptoms are worse? Maybe changing your Parkinson's medication be something that would be helpful here. you're not dosed properly or taking your medicine often enough, you might feel like you're dragging, in which case kind of tuning up that regimen would leave you feeling a lot better. So looking at those kind of patterns, and just remember too, it's normal to feel tired during certain parts of the day. I know I do. We all have a circadian rhythm during which we tend to have peak alertness and also sleepiness. And for most people, that sleepiness happens most commonly between 2 and 4 in the afternoon. In a lot of cultures, that's the siesta time. And I think it's important to honor that and to, you know, pace your activities and recognize that that's normal. And it might just be a little bit more exaggerated with the Parkinson's. I think I do have some patients who are used to just being very active and go all day. And I think it's just important to kind of respect your body and what's going on and honor it when it's tired. It's okay to take downtime. It's okay to take a little nap in the afternoon. The caveat being, I would keep the naps short as long as they don't interfere with your ability to fall asleep at night, right? So we're talking about like 30 minutes, 45 minutes, something like that as a kind of like a refresher. If you're taking multiple naps per day, then you can get into a problem where you're not sleeping at night. And then you end up sleeping during the day and you start flipping your day and night, which is not good. So review your medications. Also think about supplements. Supplements are not necessarily reviewed by the FDA, can have multiple side effects. So just something to keep in mind. Sometimes we forget to even consider those. For example, someone's taking just offhand Advil or Tylenol PM and it has Benadryl in it if you're taking it during the day, or some medication. Kind of review sleep history. I would say it's important to remember good sleep hygiene, just your basics. You want to avoid having screens or bright lights in your bedroom or close to bedtime. Think about kind of winding down. I know that's hard to do. My mom herself likes to have the TV on as she falls asleep. I think, you know, as we're alone in our bed, maybe we start thinking about things too much, and it's just nice to have that distraction. But over time, that's really going to interfere with good, healthy sleep and your overall kind of energy and ability to do things. And if you're tired, you also don't exercise or move as much, and it ends up being a snowball effect. So I think having good sleep hygiene is extremely important. Make sure to screen for depression. As I mentioned, you want to do just a good medical workup. Just check your electrolytes, your liver, and your kidneys, B12, and your thyroid. Those would be the most common things to kind of make sure are working okay. So there's a lot of supplements being touted out there for energy. Just remember, none of these need to back up their claims. They're not FDA approved, so they can say anything they want. So a lot of these just have a lot of sugar and caffeine, which can give you a lot of energy in the moment, but also set you up for a crash. So just be careful with such things. Having some coffee can be very good in the morning. Coffee has even been found to be protective for Parkinson's. I would say avoid drinking too much in the afternoon so it doesn't cause you to have insomnia. Sometimes in the early afternoons, green tea can be a little bit better. It has less of that insomnia effect afterwards. So, and I don't know if I remember if I mentioned here, yeah, I talk about meals. So I would just say one thing to do with your Parkinson's doctors, optimize your Parkinson's medication. So if you find you're always tired around like 2, that might be a normal variant of your rhythm. But if it's coming after a gap, like the last time you've taken your medicine is 8 in the morning, well, you probably need to be taking your medicine earlier and you're probably running out of steam. So making sure that you're well covered throughout the day can possibly help if it's due to that. And for example, with the dopamine agonists, if you're really tired from them, sometimes switching it from daytime immediate release variant to a long acting at bedtime might work. So there's little tweaks we can do to help there. In terms of, that's what I was saying, it's really tricky to treat fatigue. I mentioned stimulants here, and there's been some studies to see if there's some medications that can directly treat the fatigue. Say you've addressed all the other issues like the thyroid and the B12 and the sleeping, and you're still feeling fatigue, what can you do? So there's been some studies of stimulants. So methylphenidate, for example, that's Ritalin. That's one of the medications used for ADHD. That has been tried. It's shown some modest benefit in some populations. So the AAN says it might be helpful. Modafinil, which you might know as like Provigil, it's used for shift work and to help alertness. That has not been shown to be especially helpful, has not shown within the studies to be consistently helpful in the Parkinson's population. I do have some patients though that anecdotally say they feel a lot better on it. So again, it's really about tailoring it to the person. And sometimes if insurance will cover it, I think it's worth a trial. You don't know, there's no way to predict who will feel better with one drug versus another. So if you've tried everything, it might be worth trying that. Mentioned the antidepressant. Oh, just going back also to optimizing the Parkinson's drug. Speaking of the methylphenidate, there is a class of drug called the MAOI inhibitor. And a lot of you know it as rasagiline or Azilect. They used to be very common and popular for a while. But it has an older cousin called selegiline. And I'll sometimes use this in folks because one of the breakdown products is an amphetamine. So some people will feel a little like oomph with it. It's very gentle, but might be something worth trying or adding onto your regimen to discuss with your doctor. So overall, there isn't enough data to recommend any specific medication right now for the treatment of fatigue and Parkinson's. It's one of those kind of unmet needs, but there is a lot of research going on in this area. So what can you do? How can you manage this? So the one thing that comes across consistently, and if you've gone to any talks on Parkinson's in the past few years, you'll hear that exercise, exercise, exercise. The upsides of it and benefits are so great and the downsides are so low. So it's actually been shown, it's been proven that exercise truly does improve fatigue in Parkinson's. There's a lot of literature. If you there's one book called Spark that just talks about the change in the neurochemistry in the brain that occurs with exercise. The difficulty is when you're tired, how do you get yourself to exercise? It's a little bit of this like catch-22. So I kind of think of it as like, you know, when I come home on a Friday night and just you're really tired, just ready to settle and be home, your friend wants to go out and you really don't want to go. So you kind of drag your feet, but eventually you go and you have a great time, you feel renewed, and you're, you know, ultimately glad that you went. So I think you have to kind of like overcome that initial kind of hump with the exercise. Be helpful maybe if you get an accountability partner or you go to a class or even invest money that you feel like you don't want to lose. Get a personal trainer. And once you actually start moving, you'll actually feel a lot better afterwards. And I think the key is to just kind of start small and realistic and doable. So even if it's like 5 minutes walking, you can do that a couple times a week and build up from there. So there's the exercise there, the oxygenation. I find a lot of people really enjoy rock steady boxing too, because it also has the cognitive component. So keeping yourself engaged, having community and that support helps the emotional part, and then the movement. So anything you can find like that would be highly recommended to help with fatigue. And just building in a routine. One thing that fatigue is often confused for is apathy. So apathy is one of these symptoms of Parkinson's that's just really hard to treat. And sometimes even to define, it's misunderstood. what apathy is defined as sort of the lack of motivation. If you see your spouse not just wanting to initiate or do anything anymore, or not finding pleasure in things like they normally did, but don't seem sad, just kind of neutral, that's more apathy. It's just kind of like, I don't feel like it. And that can be seen as fatigue, and one feeds into the other. Okay, there's no direct treatment for fatigue, for apathy right now. There's some research that indicates that cholinergic medicines, meaning the ones that we use for dementia, like you think donepezil or Aricept, rivastigmine patch, it's thought to be more of a cognitive pathway than an emotional pathway, that kind of lack of motivation. So treating that can sometimes be helpful. But the reason I loop that into is just routine. One thing that's very helpful for routine, because most people don't have that kind of drive to initiate things, is having a routine of doing something every day to keep you kind of on track. And the same thing with your exercise. That would help treat both the fatigue and possibly some apathy. And as with anyone, just kind of, as I mentioned with the caffeine and sugar spikes, to just be cognizant of what you're putting in your body throughout the day. It can be hard because as you lose your sense of taste, what do we crave? We crave sweets, fatty meals, ice cream, that kind of thing. So you can have sort of like these sugar binges and feel energetic and then just crash. So you want to think about kind of spacing your meals, avoiding anything that's refined carbohydrates that will kind of leave you high and dry, just kind of balancing that meal. And that comes more into the kind of nutrition. And hopefully we'll have a talk here at the support group on nutrition one day for Parkinson's. But I would just say, just keep that in mind. Kind of have a nice balanced meal with some protein, some fat, and just some more like whole grain carbohydrates. And then mindfulness, just getting back to kind of the anxiety and cognitive aspects. It's found to be helpful to reduce anxiety and pain, and as a result, also fatigue. And I know there's on the National Parkinson Foundation, they have Mindful Mondays. They'll meet and go through breathing exercises, visualization, and all of that. And I did one of those recently, and they're wonderful. So I recommend that everyone try that out. And then there's energy conservation strategies. Like I said, honor your body and where you're at right now, and you're enough, you're good enough, you don't have to do more. If there's something that really you don't enjoy doing or makes you tired, see if you can hire that out or delegate or just not do it. If you know you're tired certain times of the day, don't expect yourself to be active then. If there's something you need to get done, think about what time of day is best for you. Often it's morning for some people after their medications have kicked in. By that same token, because that is your best time of day, don't try to do too much either. Some people overextend themselves and later burn out in the afternoon. So it's that old adage of, in moderation. So as I mentioned, starting an exercise program, I would say, start small and build up from there. It really, it's the only thing that's been shown to slow down disease. It helps the mood and it helps the energy. So keep exercising. I kind of alluded to some of these things. Avoid unnecessary tasks. Engage in relaxation techniques and ask for help. Don't be afraid to kind of call upon others. So fatigue, it's very common. It can have many causes. I would say talk to your doctor and consider any medications. And it might take some, trial and error. And usually there can be several conditions occurring at once. There might be depression. There might be sleep apnea. There might be getting up to use the restroom. So, I kind of always say Parkinson's, treating is like a painting, right? And there's multiple layers and many things to address. So I like to kind of do one layer at a time, see how people do, and then move on to the next layer, so to speak. In terms of future directions, there is some research being done and some data right now to indicate that bright light is very helpful, in particular blue light, and exposing people in Parkinson's with fatigue to bright light. Blue light did show some help in terms of wakefulness and energy. And there's also been research into TMS, or transcranial magnetic stimulation. And what that is, it's a magnet that's placed somewhere on the head over an area of the brain where you'd like to kind of stimulate. So as I mentioned, doing some neuroimaging studies in patients in Parkinson with fatigue, they seem to decrease blood flow in front of the brain. And this magnetic stimulation might help increase blood flow and activation in this area. So that's one potential future treatment. And that's one way exercise can be looped in too. If you go out in the early morning, get exposed to bright light and movement, that's a way you can kind of get all three. So I would say definitely bring this up with your physician. And if one treatment doesn't work or help, don't be discouraged and just keep trying. So at this point, let's see, it's 6:38. I'll be happy to take your questions.
Okay, Dr. Kirk, if you don't mind not sharing your screen anymore. Before questions, we are going to, Martha Ann had something that she wanted to share. So let me spotlight her. You are on mute, Martha Ann.
Oh, there you go.
Hey.
But I was muted by the host, so.
Oh, sorry.
So now I've lost everybody. Can you see me?
Yes.
Mercy, mercy. So you can see me, I can't see you. Okay.
Well, spotlighted.
That's okay. My screen went blank. I wanted to just let everybody know very briefly after Dr. Kirk's great presentation about some things that we have coming to bring your attention to. We're going to be more details in the coming newsletters. But tomorrow, which won't be in time for a newsletter, you can tune into the PD Health at Home program at 1 o'clock to see me talking about mood, cognition, and sleep, along with movement disorder specialist, a physician from Oregon, and a physician from Harvard. And so I'm excited about that. And there will be some Q&A with that as well. And that's from 1 to 2 o'clock Eastern time, again, free, but you do have to register. So you can simply go to parkinson.org, look at PD Health at Home, and look at May the 26th for that program. And then we have this summer, the Parkinson Foundation is going to launch a care partner course. And they hope that this is going to be sort of the gold standard for care partners, and you'll get like a certificate at the end. It will be free. It'll be released like 1 or 2 modules at a time. You can complete at your own pace, and it's just going to sort of be maybe the standard of care partner training. So it would be great preparation if someone wanted to then form their own support group or whatever. So that's going to be coming up. And then August the 20th, we are going to have our first in-person outreach since we all shut down in March of 2020. And this is going to be back at the Kroc Center. It's going to be lunch again. That's a Friday. And this is going to be sort of a restore, recharge, and reconnect for care partners. It's just for care partners to recognize the strain that this has been for you all during this lockdown, just an extra level of challenge for all of us and for you specifically. So this is meant to be an uplifting, encouraging program. We're going to have someone singing Frank Sinatra tunes. So we're going to have Jenny Montgomery, a local community leader and TV host, talking about self-care and encouragement. I'm going to do a drawing for a 60-minute massage and a drawing for salon treatment at DJ Salon here in town. So it's going to be a fun time. I'm limited to only 40 people because of COVID. So we have 40 people in a room of 100. So when that comes out, make sure you register early. It's open to anyone. And then the last thing I want to say is that I wanted to tell everybody we've started, I'm excited about 3 Care Partner Awards, and this will be the first year. We hope to make this annual. These will be chosen in October, awarded in November, and it's simply for an outstanding care partner. And each of the 3 recipients will receive $500 Amazon gift card and a trophy. And all it takes to enter is to email me at mtutor@augusta.edu. And the only requirement is that the Parkinson patient that this care partner supports is a patient of our program at Augusta University. But anyway, and you can nominate yourself, you can nominate your partner, you can nominate a friend, doctors, anybody can nominate someone. So send it on in, just tell me why. There's no word limit. If you want to send a photo, that's great. So we're excited about these things to hopefully provide another level of encouragement and support for our care partners. And I just wanted to let you all know that. Thank you for giving me this time.
Thank you, Martha Ann. We appreciate it. So at this time, we do have a couple questions that came in. I am going to add Dr. Keurig. Okay, so our first question is, when my tremors are especially bad, I feel exhausted, like I've just worked out. Do other people feel this way?
Yes, so great question. Absolutely. That is one of the motor symptoms. So you feel like your arm's worked out because it basically has. Your muscles are moving in an ongoing fashion. So both the tremors and also the dyskinesias, for those excess movements you kind of think of as Michael J. Fox having, those can be both very tiring.
Okay, thank you. Our next question is, I've had 3 episodes of sudden onset sleepiness / fatigue, as though I'd been drugged. I became so groggy, my husband had to help me into the bed and undress me. Is this a symptom of Parkinson's or something else?
So from that description, I can't say. I would have to get a little bit more context, but what I would say to consider is that the fact that it's so sudden, it doesn't seem like it's just the Parkinson's. It's Parkinson's in the context of something else. So you mentioned feeling drugged. You might be. For example, if you are taking those dopamine agonists, for example, you're taking Requip or Mirapex or Ropinirole, or Rotigotine, the Nupro patch also, those are known to have, as I mentioned, sudden attacks of sleepiness. So if that's one of the meds that you're taking, I would consider maybe discontinuing that medication. Also, if it's happening suddenly, I would think about maybe you're having some drops in blood pressure. As I mentioned, with Parkinson's, you can have your blood pressure tends to drop. The Parkinson's medicine drops it even further. And with, now, especially remember, it's the summer. We always have non-sensible water loss. So you have to make sure to stay hydrated and be really aggressive about that. I always tell people to put electrolytes in their fluid too. It's kind of like when you have potato chips, you feel bloated. That's what we want. We want you to retain that fluid so your blood volume is increased. If you just drink, you might just end up peeing it out and running to the bathroom more frequently. But if you take it with some electrolytes, it'll help you hold on to that. So especially if it's happening with changes in position where you feel suddenly more tired or a certain time of day, it might have to do with your blood pressure. Think about also your medication timing. If it's happening suddenly, maybe you've gone like the Energizer Bunny, and suddenly your batteries just run out. It's the end of the day, you've been busy, and your medications have now worn off. It can hit you really hard all of a sudden. And also consider what other stressors might be going on in your life. If you're particularly stressed, or even if you're dealing with a mild infection, UTI, you might feel suddenly more tired. So I would say think about the other things are going around you at that time. So I wouldn't say it's attributable to specifically the Parkinson's, but it's the context within which all these other things can happen.
You brought up bringing, this is not a question, but adding electrolytes to the fluids that you drink. Is there, something that you would suggest to add? Because I know that a lot of the stuff that's sold that has electrolytes, the powders and things, are just a lot of sugar. So obviously.
Exactly. So, I hate mentioning like a brand or something like that because I have like no ties or don't want anyone, but I know one I use, my husband uses, so I like it because it doesn't have a lot of sugar. It's nicely balanced, and is Noon tablets. It's NUUN. They come in all sorts of flavors. So if you don't like drinking water, maybe it's a little bit more palatable, and can be replenishing and help you just really have a good fluid absorption. So I like those, but I would, yeah, ensure, I don't know, I know that's a good protein drink. I don't know if that's an electrolyte drink, but yes, it says electrolyte drink. So I would say the key thing is to avoid things that has a lot of artificial colors and a lot of sugars, because the sugars will again give you that crash. So anything you can find, and you can even make your own mixture if you want, like the World Health Organization has like a cheap Pedialyte solution, which is like water with salt, maybe a little bit of sugar. So, even broths and soups and all those things will have that kind of stuff in it. So anything you like and can take, that's what I recommend.
And to drive that point home, she just said, none of this is sponsored. No one gets, anything like that, just to make sure everyone's on the same page. The next question is, driving is becoming a problem as I sometimes get overwhelmingly sleepy. I'm afraid to drive on a long trip. Should I take an additional dose of Cinemet? Did I pronounce that correctly?
Mm-hmm. That is not a question I can answer without knowing you, because Cinemet is one of those medications that can be energizing. You mentioned, I think Connie was the same person who asked about the tremor. So some people with tremor need a lot of Cinemet to control that. And if that's the case, then maybe you need more Cinemet, because tremor just requires a high dose to be controlled. But again, remember, I mentioned the dopamine agonist. One of their side effects is sleep attacks. And it actually came out a sleep attack which occurred while driving and resulted in accidents. That's how it got the black box warning. So sometimes actually increasing it and some can make you sleepy. So without knowing you and your response and your pattern more, that's not a go-to. It's not like more is more. Like taking more of this medicine is going to make everything better. No, it could actually go the other way. It can make it worse. Just like Parkinson's medicines help certain things, but it can make constipation worse. It can make your blood pressure worse. So you have to know what you're treating. It has to be mindfully taken. That makes sense. And the following I see, can dehydration contribute to fatigue? So I think we answer that. Yes, it absolutely can. Anyone, you'll see, just anyone, Parkinson's or not, if you're not hydrated, you can feel tired. So it's often a tip to reading magazines. If you're tired, consider drinking more water throughout the day, right? It's something we forget. We get busy and we go. So finding a way, however, helps you drink, whether it's adding something flavored or getting a certain bottle. Some people have these fun hash marks on there that says, this much by noon, this much by dinner, I'm done. However, it helps you setting out a certain number of bottles for the day. Just make sure to keep that fluid intake going.
Well, I don't see any questions on Facebook. And I think does anyone else have a question here that they want to ask on Zoom? I don't see any coming in. Well, thank you so much for joining us today. If someone would like to contact you, how would they go about doing that?
I would say probably the best direct way is through my email, which would be jkurek@augusta.edu.
Okay, perfect. Well, again, thank you so much, and thank you for your presentation. Thank you everyone for joining us. I did want to make the announcement, and I know it has not come out yet in the newsletter, but at this point in time, we are talking about next month's meeting being in person. Location to be determined still, socially distanced and masked as well. So I just wanted to make that announcement. With the way the world works and the way we've had this past year, things could change. So don't quote us on that. At this point, nobody can predict the future, but we hope to see you in person. And if not, we will still be live streaming on Facebook, still be hosting on Zoom as well, even in person. So if you're not comfortable yet joining us in person, we still welcome you to join us online. So again, Dr. Keurig, thank you so much for your time. Thank you, everyone, and have a great rest of your evening.
All right. Great to see you all. Thank you.
Thank you.
All right. Get your vaccine if you haven't gotten it. And exercise. All right. Bye.
Bye.